Hello, my name is Mahendra. I am student of postgraduate program of Public Health University of Halolo, Kendari, Indonesia. I will present my article entitled Analysis of AFB Pulmonary Tuberculosis Prevalence at the Wuna Community Health Service Center West Wuna District, South Sulawesi Province, Indonesia. Fine, I feel one is abstract. Tuberculosis is a direct infection disease caused by Mycobacterium tuberculosis. Transmission occurs when a tuberculosis pathogen chain or sinus games are spread into the air in the form of lake droplet. The study used data from the Wuna Community Health Service Center, Wuna District, data on AFB Pulmonary TB tuberculosis case were obtained from the health center from 2015 to 2017. Calculation AFB pulmonary TB case from 2015 to 2017 were fluctuated, where in 2015 the number of FB pulmonary tuberculosis was 14 cases. In 2016 it decreased to only 2016 it decreased to only 28 cases, while in 2017 increased to 43 cases. AFB pulmonary tuberculosis case to fluctuated and case increased 2017. The majority of patients with AFB plus pulmonary tuberculosis case in the Wuna Community Health Service Center working area in the age range of 45 to 54 years. Next, my introduction. Tuberculosis in infection disease caused by Mycobacterium tuberculosis, which can be transmitted through blood droplet. Tuberculosis is not a hereditary disease or cause, and I can be cured with regular medication. Under supervised drug administration, tuberculosis is direct infection disease caused by tuberculosis germs. Most tuberculosis germs attack the lungs but can also of their organs. Next is introduction. Next, methodology. The Wuna Community Health Service Center is a first level of community health center. It is located in Wuna village, serving 8 villages into 5 villages, 3 villages from Barangkas subdistrict and 2 villages from Sawagadi district. The majority of the people livelihood are farming. The distance from the postcase to the district capital is 5 kilometers, and the distance from the to the district capital 6 kilometers by land transportation. This study is various data from the Indonesia government. Data on FB plus pulmonary TB case were obtained from the North Wuna Community Health Service Center from 2017 to 2017. The data was taken from secondary data of the health center. Research results are present a figure format. Next is result. Data of FB place pulmonary tuberculosis by gender. Figure 1 number of cases by gender in the Wuna Community Health Service Center working area in year of 2050, 2015 to 2017. The result showed the based on gender from 2015 to 2017, the distribution of AFB pulmonary TB tuberculosis case plotted, where in 2015 the highest occurred in the female with 17 cases, and 2016 the highest occurred in male with 24 cases and 16 cases in women. Meanwhile, in 2017, AFB plus pulmonary tuberculosis case, but when men and women were the same, but the frequency of severance was relative small compared to provincials. Figure 1. Next, data of AFB pulmonary tuberculosis by residents. Figure number 2, number of cases by settlement in the Wuna Community Health Service Center working area. Based on the figure above, it showed that the village with the highest number of sufferers is in the Wole with 13 case, while the lowest is in the Maparaha area with 11 case in 2015 to 2017. The AFB positive pulmonary tuberculosis patient in the working area of the Wuna Community Health Service Center, namely Wole Village, Lavinde Village, and Mihi Village experience in increased case, and for Wuna Village and Mapera Village experience fluctuations is 2015 2017. Next, data of AFB plus pulmonary tuberculosis by age group. Figure 3, number of cases by age group in the Wuna Community Health Service Center working area. Figure 3 show that there are more patients in age of 45 to 15 years as 30 cases, while the fewest sufferers are in the age of 65 years above as 2 case. Next, discussion. According the result of research, the prevalence of tuberculosis in Indonesia based on diagnosis is zero. In diagnosis, according to the result of research, 2013, the prevalence of tuberculosis in Indonesia based on diagnosis is 0.4% on the total population men will, according to the Indonesian Ministry of Health 2017. In 2016, in Indonesia, new case of AFB plus pulmonary tuberculosis were found with a total of 156,723 patient, where their cases were more common in men at 61% compared to women at 39%. The high number reported cases was in three provinces and Java with 20,717 for Kemenkes Republik Indonesia 2018. Next, conclusion. Prevalence of AFB pulmonary tuberculosis by gender in the study is in accordance with the literature where male is at greater risk of pulmonary tuberculosis disease compared to female. In fact, men are rather relative from smoking and drinking alcohol compared to women, in which their habits can lower to the body immunity that leads to more susceptible to pulmonary tuberculosis disease. The prevalence of AFB plus pulmonary tuberculosis AFB by age group 15 to 15 4 years as 65 respondent 67%, and it found less in the age group 15 5 years above at 22 respondent. It is assumed that the body resistance begins to decline after the age of 45, making it is susceptible to disease. Okay, thank you very much.